All right, let's get some analysis on this week's medical developments. Joining us now are Dr. Lipi Roy, an internal medicine physician and MSNBC Medical Contributor, and NBC Medical Correspondent Dr. John Torres. Good to have you both with us. Dr. Roy, let me start with you. We heard this startling prediction last week from Surgeon General Jerome Adams on Meet the Press.
The next week is going to be our Pearl Harbor moment. It's going to be our 9/11 moment. It's going to be the hardest moment for many Americans in their entire lives.
How did this past week compare to that prediction, Dr. Roy?
Good evening, Joshua. It's good to be with you. We've all seen that this health crisis has unleashed social and economic destruction that's beyond scale, beyond comparison to most of us. You know, we've unfortunately seen a lot of death, far, far, far too much. And let's be honest, at this point, we know that the death toll that we've been seeing it's a lot of it was really preventable. A lot of this has been, unfortunately, death by bad policy. So we really need to get a lot more action from the federal level, action that's actually now happening at local and state levels.
Dr. Torres, let's stick with this graph that we have on the screen right now with regard to the shifting projections for the number of deaths as time has gone on, because there are a lot of models that have projected the number of COVID-19 deaths and their rates and their peaks and so on. There's the IHME model, the Columbia University model, and on and on. Dr. Torres, break this down for us, for those of us who are not medical statisticians. What are these models and what should we take away from them? I mean, they can't all be correct, right?
And you're exactly right. They can't all be correct, and they're not all going to be correct. And what you're seeing is a fine-tuning of the models as time goes on. These are essentially just mathematical projections. They're very highly educated guesses into what's going to happen, but they're only as good as the data that gets put into them. And so if you have a couple months of data, you're not going to get that good of a model. If you get 3 or 4 months, it's going to improve. So the further along you go in something like this, the pandemic, the closer the models are going to be to what reality is. The perfect example I can give you is hurricane forecasting. A week before a hurricane hits anywhere, it says the models say it's going to hit the entire East Coast. So we really have no idea where it's going to go. And as the days go on, it narrows down to finally the day before it hits, they can kind of pinpoint where it's going to go. But as they get more information, they can do that. Same thing here. So we're getting more information. You remember last week they were saying up to 240,000 deaths. Now they're saying around 60,000 deaths. That's because they've gotten more information. They're able to fine tune that model more, and they're able to get more accuracy out of it. And that's why it keeps changing so much over time.
Now, Dr. Roy, these changing projections depend on us doing everything we can to slow the spread of coronavirus, social distancing, wearing face coverings, not surgical masks, unless you're a healthcare provider, unless you have coronavirus, but face coverings, just cut up a bandana, and so on, doing things like that. At what point would we need to be at on these graphs, Dr. Roy, to know that we're not reopening everything too soon? Does it have to be 0 infections, 0 deaths nationwide, or is there kind of a safe range in which we could normalize life?
Yeah, again, just to drive home a point that Dr. Torres made that was related also to something that Dr. Fauci said a couple of days ago. Remember, Dr. Fauci said in context to the 60,000 projection versus the 100,000, 200,000 death toll projection, he said that the model is hypothetical, but the data is real. So that 60,000 number, how did we come up with that? That was because all of the physical distancing or social distancing, all of those public health measures that we were practicing showed that these measures work, right? And by the way, we've had thousands of pandemics or epidemics over the course of history. For as long as human beings have existed, epidemics have existed. Ever since 1918, influenza, where we practiced social distancing back then, we know that these things work, but we just really need to put into practice, which means that we need to really fund public health measures and public health agencies and organizations so that the next time we have an epidemic, which we will be better prepared. So, yeah, ideally, we need 0 transmission, and that's the only way we'll be able to determine that is through widespread testing and contact surveillance and all of these other good old-fashioned public health measures. That needs to take place widely nationwide.
Before I let you go, Dr. Torres, I think a lot about normalizing life. Of course, that's a very relative term. Things normalized after 9/11, but many things never went back to the way they were. There was a new normal. How do you think our nation will normalize after this? I mean, more hand washing, no handshaking, fewer people on transit, more people working from home. What do you expect?
And that's a perfect example, 9/11, because we never got back to pre-9/11. We still have security checks and things we didn't have before. You can't walk to the airport, to the gate with a loved one right now like you could before 9/11. So I think what you're going to see is some of that. So initially, you're going to see more hardcore separation. You're going to see criteria, people maybe wearing masks, looking to see if there's hot spots. If they are, then clamping down on things a little bit. And sporting events is probably going to be a great example. I think initially you're going to see the athletes by themselves. Then you're going to see maybe half the fans there. And then eventually we'll get to the full fans, so you don't have to necessarily have that separation. But it depends on, again, getting everything under control. I'm guessing over the next year or so, as we wait for it to come back again, coronavirus in the fall, that we're going to start seeing some loosening of all the guidelines and people being able to go out and about to a near normal life. But I think to get to normal, which is going to be a new normal, I think that's going to take a year or more to get to that point. The vaccine is going to be a big player in that, and we think that's about 12 months away.
All right, Dr. John Torres and Dr. Lipi Roy, thank you both for making time for us. Much appreciated. Well, life for many Americans